health workers wear protective equipment as they prepare to tend to suspected Ebola patients. Saturday at Bikoro Hospital, the epicenter of the Ebola outbreak in Congo. Mark Naftalin, AFP, UNICEF. The United States is planning to provide several $1 million to support the global response to the growing Ebola outbreak in Congo, officials said Friday. Details are being finalized, and an announcement is expected early next week. The outbreak, the most serious since the 2014 West Africa epidemic that killed more than 11,000 people, does not yet meet the criteria to be declared an international public health emergency, the World Health Organization said Friday. But the WHO, in a statement, said, a vigorous response from the international community is needed to prevent a sharp escalation in the outbreak. The discovery this week of at least one case in a densely populated port city on the eastern bank of the Congo River has raised concerns about the potential for rapid spread of the disease, which had previously been limited to a remote area in the rainforest of Congo's Equator province. To date, there have been 45 cases, and 25 of those people have died. More than 530 individuals may have been in contact with infected people and are being monitored, and they may be candidates for the first round of an experimental vaccine. WHO officials estimate that outbreak control efforts will cost $26 million over the next 3 months. So far, the WHO has received commitments for about $9 million, so we are about $17 million short, Peter Salama, the WHO's lead official in charge of epidemic response, said during a news conference in Geneva on Friday. That may sound like a considerable amount, he said, but not compared with the Ebola epidemic in West Africa, which cost between $3 billion and $4 billion. So this is a relatively small investment to stamp out a small outbreak quickly, for a major gain in lives saved but also in dollars saved, he said. Some global health experts have expressed concern privately that the U.S. response would be minimized given President Trump's disparaging and isolationist comments about Ebola during the 2014 epidemic. Complained about 2 sick American health workers being flown back to the United States for treatment and said they should not be brought into the country. The U.S. response so far appears to be appropriate for this outbreak,